from breakthrough strategies to game-changing innovations and cultural shifts. You'll discover the lessons that drive real impact, and we'll dive into the moments that changed everything. Welcome to The Missing Piece with April Reed. Today on The Missing Piece, we're joined by a physician who's deeply passionate about redefining healthcare from the inside out. Dr. Amy Neal is the Associate Medical Director at Capital Health Plan in Tallahassee, Florida, where she cares for patients daily and leaves physicians with a commitment to fairness, honesty, and true empowerment. She is board certified in both family medicine and obesity medicine, pairing her clinical expertise with a holistic approach focused on prevention, vitality, nutrition, and physical fitness. Beyond the exam room, Dr. Neal brings business strategy into healthcare with an MBA from Florida State University. She also serves on the board of directors for the Capital Medical Society, regularly speaks at community outreach events, and leads the local walk with a doc initiative, encouraging people to take control of their health one step at a time. Neal believes that whether you're a patient or a physician, you deserve to be listened to, supported, and equipped with the right information to thrive. Please join me in welcoming Dr. Amy Neal to the Missing Piece podcast. Thank you for being here.
Thank you. Thank you, April. That was a wonderful introduction. I really appreciate that.
Well, I'm excited to talk to you and listen to the wealth of knowledge that you are, the passion that you have about what you're doing. But let's go back to the beginning. Why did you become a physician? How did it all get started? Introduce us to who is Dr. Neal?
Yes. Well, I'm from North Florida. I grew up actually on a small goat farm in the northeast side of Tallahassee in a fairly rural area in a co-op. So, we had very simple beginnings. I lived in a trailer for a long period of time. One of my favorite things was showing my goats with 4-H. So that's where I came from. I used to think I wanted to be a veterinarian until I realized that I much prefer when I can hear back from whoever I'm treating about how they're doing. So that's kind of where I came from. I had a very important mentor, now she's a doctor, Dr. Anderson, who helped guide me. She was one of my big mentors, but I became involved in the STRIDE program that helps to guide people who are interested in healthcare into actual healthcare fields, especially if they're not from a medical family. That really was very helpful. So in essence, that's who I am. I decided I want to go to med school to help people, and still that's my guiding star. So
there's nobody in your family that was a doctor. Are you the first doctor in your family, or?
So my cousin beat me to the punch, but she's an MD, PhD. She was part of the Human Genome Project. So not exactly. My mom is a nurse practitioner in town, but she didn't get her degree until I was a teenager. So I watched her kind of go through that process.
Yeah.
I think I got my lifetime love of learning from my mom.
Oh, I love that. I love that. So yeah, I did not know that you grew up in a co-op with a bunch of goats. That's amazing. No. That's a really fun fact. I always like to find out the fun facts. That one is takes the cake on all of it. That's amazing. So go Noles. I know you're a Florida State grad, which we love Florida State in our family. So I have to do a little plug for that. Along your journey, why did you decide to go into obesity medicine, or really kind of hone your craft and your specialty for, nutrition and vitality and longevity? Like, what was it that triggered that initiative for you?
Absolutely. Well, growing up, a co-op, you would think my parents were probably hippies, and they sure were. So we had like the whole grain bread and sprouts, and I always grew up kind of eating a pretty healthy diet. I was very jealous of the other kids in school who had handy snacks and things like that. But as I grew older, I became more aware that, of course, what I was eating was not the norm by any means, homegrown food versus, processed foods. And then as time went on, I became more and more aware of the effects of that, as well as, the effects of sleep deprivation and whatnot. I think how I initially kind of backed into the obesity medicine sort of thoughts and paradigm was I went to a conference. Just like you, I've always been interested in lifelong learning, and this was something that was kind of outside of my wheelhouse, and I like to challenge myself. And I said, "Well, this sounds sort of interesting. I wonder what their take on this is." And there I learned so much, some of the twin studies where, back before anybody would ever sign up for this, they actually studied what happened to twins when they were separated at birth and were raised in very different nutritional households as well as sleep and all these other things and how that plays into, did they eventually develop obesity in adulthood? And I mean, it's just there's so much to learn about
Wow.
obesity that we just weren't taught any of that
Yeah.
when I went to med school, which wasn't that long ago.
Oh, interesting. Yeah. It's fascinating because that's where I was going. I'm like, people don't know. This isn't.
Mm.
So, what is your thought in regards to practicing medicine and really trying to empower your patients and educate them in regards to their health? But they walk in the door and they think, "Give me this medicine that's gonna curb my appetite, and or can you let's go straight for surgery, bariatric surgery," like, do you feel like you're up against that in this space? Or where do you even get started with your patients
Yeah.
on the saying, "Okay, I know I'm unhealthy. I didn't know. I want to learn. How do I get started?" Where do we even start?
Mhm. Well, I think the very first thing that I had to tackle, and I didn't even know this at the time, was my own kind of weight bias that I had, right? So, what we're taught is it's calories in, calories out. Obviously, this is an overeating problem that we have here in America. And it's just not true, So
Mm,
learning the facts about that, learning, the evidence shows that exercise is not great. I mean, yes, it helps to maintain weight loss, but that alone is not going to help you lose weight. Almost all diets are going to fail eventually. And so, people come in and they're frustrated and they're mad and they don't want to be on these medicines. And to me, one of the big light bulb moments was when I was like, "Well, hey, let's deal with your weight problems first. Let's work on this lifestyle stuff and see if we can
mm,
do that instead of medicines." And patients love it. They're so
no,
excited about coming off their medicines, reversing their
mm,
disease. It's something that I feel like really empowers them, and it makes my job a lot easier.
yeah,
'Cause all of a
yeah.
sudden, I don't I'm managing less medicines, I'm doing less in some ways, but it does mean a lot more, learning where that patient's coming from, learning their history, how did they come to this
Mhm,
point? What are their motivating factors, right? Like, why are you going to make this lifestyle change? Is it for your family? Is it so you can look better? Is it so you
mhm,
can put on your shoes in the morning?
mhm.
So
Wow, that's awesome. So, do you like if I were a patient with you and I come see you, Dr. Neal, do you stay with me for a certain period of time? Like, are you on this journey with me? And so we build a relationship for over the course of a year? Is that how you
yeah,
establish with your
so
patients?
for my own patients, I have a panel of my own patients, and you know, thick and thin, whatever the problem is, they're my patients from sunup till sundown. That's how we do it in family medicine. I do a little bit of consulting and a little bit of
Mm,
work through like chart consults, and we're starting a new program that I'm hoping maybe I can reach more people directly. Um, we're doing a new vitality program at Capital Health Plan. And again, I would like to maybe do some of the group visits there or do some of the talks. That's part of why I like speaking places is my panel is pretty full, but I want to be able to reach, anyone in my
boy,
community or anyone in the nation who's interested.
I love that. Um, when I introduce you, I know you do these walks with the
Yes.
community.
Yes.
So
Another
tell me
great way to
more
find
about
me.
that. Yeah, I love it. Exactly. So tell me more about that. How did you launch
Sure.
that? Did you start
We're We're finishing our 2nd year. I gotta give credit where credit is due. Dr. Omatayo, who was my predecessor, he was our medical director at the time. He said, "Have you heard of this program? I think this would be good." I'm putting together something. We're gonna see if we can do it, but you need to be the lead on this." And I said, "Okay, sounds fantastic. Sign me up." We're finishing our second year now, and what we do is every month we have a walk. So everybody shows up at 9 o'clock. It's always the second Saturday, consistent time. You're usually at Cascades Park, but once a quarter we will take a walk somewhere else just to shake it up a little. And we have a 10-minute talk on some sort of topic, whatever it is, some sort of health related thing. And then we head off on a 40 to 45-minute walk, sometimes longer. People talk, they meet friends, they really enjoy having a chance to talk to doctors. A lot of doctors actually go to these events.
Mm.
So that's to me also been kind of fascinating. So the topics are like skin health, heart health, weight management, health, art and medicine, arthritis awareness. Anyway, so we have a whole host of topics that we cover.
I love that. And what a way to get the community involved to where they're saying, okay, surround yourself with the like-mindedness of the physicians that are helping you to the other people, make friends, put yourself in that community. My biggest thing is birds of a feather flock together because I
Mm,
feel like whoever you want to be around, that is where you will go. And so join the walk, join the community if that's, where you want to go. People that want healthier lives and want to live longer and want to be around and want to learn and grow and then make friends. So I love that. That's really a neat initiative. I actually haven't really heard of that too often. Unfortunately, like to your point, it's where,
yeah.
if I want to see a physician, it's inside of a room, and so
Right.
not necessarily walking with them. I
Right. And
mean,
it's one on
which is
one.
amazing.
And you don't get that synergy of the group because sometimes it's more powerful to hear another patient say, or explain how they have conquered certain fears or
Yeah.
issues, that I haven't necessarily gone through. I mean, I don't mind sharing other people's story, but it means so much more coming from different people.
I know when it comes to one last question around health and your patients and specifically obesity, but I know when it comes to eating healthy, there's a cost to that. How do you overcome that with your patients in the sense of how expensive it is, And I think there's a stigma around it, but then there is a lot of
Yeah.
truth to it, how expensive it is to eat healthy.
Well, one of our biggest issues and something we're working on as a community is that here in Tallahassee, I think we have the two poorest zip codes in the state of Florida, and they're food deserts. They're places where you can't just easily get to the grocery store and get fresh fruits, vegetables. We're working on getting farmers markets together, food shares, pickups where people can just pick up healthy vegetables, better options, but then do they know how to cook them? Are they able to do something with that food besides just pick it up and let it sit there? And so as a community, we're working on that. I know that we're working on getting, like I said, additional places to be able to get healthy food. So some of it's just, can you physically get to where the food is?
Yeah.
Beyond that, I will say that one of our ongoing themes that we see, so another thing I'm working on is my lifestyle medicine certification. Obesity
Yeah.
medicine and lifestyle medicine are just slightly different, but the nutrition, I always like similarities, right? Like, so you can read nutrition articles and quickly get yourself turned around in circles. What's good, what's bad. But consistently, we see that the more fresh fruits, vegetables, seeds, nuts, whole grains people are able to get into their diet, the better they're doing. And those tend to be relatively affordable, especially compared to especially meat products these days, certain cheeses and whatnot. So, dried brown rice and dried beans, and if you've got a crook pot and a little bit of time, you can make a pretty cheap, really healthy meal.
Yeah.
But it's a challenge. It really is.
Yeah, but like where there's a will, there is a way,
Hmm.
to your point. Like you really, really can. You just might have to get a little creative or invest the time, to your point, to soak the
Hmm.
beans and just take some time or learn new tricks around it. That's amazing.
Hmm.
If you had unlimited resources and unlimited money, what would you do? What would Dr. Neal do? What would you create? How would you disrupt healthcare? How would you take what you know and everything you do and put it on steroids and impact the world?
So I think one of the bigger things I would do would be to start implementing better group multidisciplinary visits for lifestyle and obesity medicine. So that would look like, you go in there at whatever on your lunch break, 1 o'clock. You do a culinary medicine clinic. You eat there because you just cooked your food. You just figured out how to make this meal. You sit down, you talk to your group. Maybe you have a couple small one on one meetings with your health coach to help you see how you're doing with your goals. And your goals, have already been set up either virtually, maybe using AI, but, through different ways, you have both a clear goal, but also you've kind of got your group that you're meeting with regularly. When we look at blue zones and people who tend to live healthy lives into their 90s and hundreds, those people consistently have kind of a group of people that they're going through life with. They have these healthy social interactions and they have this synergistic effect of helping you eat better, sleep better. You've got your tribe that you're going through life with, like you said. Maybe you're exercising together. So and that de-stresses most of us to have a group like that where you're being heard, your needs are being met. So to me, that would be a big thing. And maybe some gardens as well. Community gardens are good because they get people out, but you also get the free food and, healthy food out of it. Having grown
Yeah,
up on a
that's awesome.
co-op, I'm a little biased.
I know, I love it. Add some chicken too. Get your go get your eggs. That's amazing. So I heard you mention AI, and
Mhm.
I have been a huge fan of how much AI can help others. To your point, I mean, you can take a picture of your refrigerator and of what's inside of it, and it can match, recipes, like what would be something that you could make from a healthy perspective. Or if, you do want healthier meals, chat GPT, you can ask those things. So AI is super impactful from a personal perspective. How much have you, exposed yourself to it, or where do you see it fit into what you're doing specifically with patients? And not only, I mean, AI's been around for years, but right now it's really accessible to just like everyday people, and I feel like it could make a huge impact. But just your thoughts around all of it.
I think I see it as being a really helpful coordinator of care or maybe kind of helping to connect some of these missing links. Like a multidisciplinary team to me could be much better connected and, more tightly woven together with the use of AI. Another thing I see it doing maybe is helping us make suggestions. I think that in the future, it'll probably be helping us figure out what is the most cost effective treatment, right? So, uh, this is your very particular kind of insurance. The formulary just changed. What can I best treat you with in this category of medicines that's going to be affordable and easy for you to get? I see it as being extremely helpful also just in the burden of documenting all this stuff. It already is being used in notes across the nation and it is making primary care significantly easier and for people to get that good quality preventive care. Um I in the future, I also kind of think that, as people have always been Googling their symptoms, but now I think, with the advent of AI, they're getting even a little more savvy with it. And so we'll see.
Good, bad, and indifferent, because then they
Yeah.
come in and they're like, "My arm's falling off because ChatGPT told me that."
Yeah.
So I'm sure you probably see it from all the angles. How has it helped you? I mean, I know you mentioned, documentation. Have you used, like, the scribe features when it comes to AI and things like that, that just help the efficiency for you?
Yeah, yeah. Here at Capital Health Plan, we made the decision to go with basically a mobile device that allows us to go in there, just talk to the patient real time, maybe call out some of the physical findings, put in some diagnoses from that system, some from our old system. We still have to check. You still have to really proofread that information, but it saves us tons of time. I can
Yeah.
also turn around notes faster to get referrals out faster. Patients like it because they're going home with like a real plan all written out. So
Awesome.
I think it's been revolutionary already.
That's amazing. A lot of people, haven't necessarily tapped into the scribes. What
Mhm.
EHR are you using?
We use NextGen.
Okay. And a lot of them, like I know, I'm not sure about NextGen, but I know like Athena and some of the others are coming out with these tools that are really beginning to help and create that, effortless documentation faster and more effective, and then making sure that it's correct. And you want to be patient facing. You don't want to be sit there typing your notes
Oh,
or
yeah.
documenting. You're like, I just want to see my
I
patients.
I do think patients notice a difference. I think they're overall pretty happy with it. We may do a little poll. We do a yearly, patient evaluation and survey, and that's one of the
Mhm.
things, we would
Yeah,
kinda like their feedback about it. But so far, just in conversation, people seem to
that's
appreciate me being able to kinda set the computer aside and pay attention to them, or
yeah.
because I'm not in the middle of documenting something, I can more easily find the answers to their questions, look through their chart and find things, so
Yeah, that's awesome. When it comes to patient education, you give them that, like you said, here's your plan and you hand it to them. Is there anything else that, like I guess the patient portal, do they have access to ongoing training with you specifically, or that's just set on as they're following back up?
usually, I would just follow him back up. At
Yeah.
some point, I did have a clinic that was a multidisciplinary clinic, and we would do group visits. And logistically, that was tricky. I think that, again, I think AI can be really helpful when it comes to,
Mhm.
a group visit and documenting what all's going on there. But again, I'm hoping that maybe there's some additional training that we're going to be starting up as part of the Center for Healthy Aging and our new vitality program. It's looking really good. We're like hiring people and putting, time schedules in place and trying to figure out the logistics, but it looks like it's going to be a really exciting program.
That's really exciting. I'm so excited because I do feel like we're in a time where vitality and longevity is also, at the forefront of everybody's mind. And I know for my husband and myself, we're our, mid to starter to be late 40s. And we do want to be around and we do want to understand what can we do now before it's too late, and what should we have been doing all along? It's everything from just eating appropriately, but it's a whole treatment. And that's what you're doing is treating the whole person from head to toe, which is awesome. And then even, walking, and I'm sure that even the talking and unpacking what is your belief structure? Why do you think that way? Why do you think you can't afford it? Or maybe you can. You just have to reframe that. Some of the things that we've talked about. I've really enjoyed our conversation. What would you say is the missing piece for on the clinical side or in the healthcare organization, or the missing piece for patients that you would want to tell them to say, this is how you can find those answers or unlock maybe something that you didn't know or haven't considered or thought of that has been a huge, like you said, a light bulb moment for you?
Well, so there's probably a few things. I would say the missing piece in healthcare right now probably is lifestyle medicine, which takes components of obesity medicine. Obesity medicine has the four pillars: behavioral changes, nutrition, medications and surgery, and then exercise or activity. The six pillars of lifestyle medicine are nutrition, sleep, really focusing on sleep. That's a big deal for many people.
Mhm.
Stress, food, exercise, and avoiding harmful behaviors. In terms of healthcare at large, if we could address those issues, 95% of all of our healthcare problems in the US come from issues that deal with those 6 pillars. So that's like a foundational issue, right? If we could address our chronic insomnia, our standard American diet, our inactivity, yes, it's several different things, but I think addressing that first rather than just jumping on, oh, you have high blood pressure, let's put you on a blood pressure medicine, you have diabetes, let's get you on some metformin. To me, doing the lifestyle first or treating the obesity first, if that is an issue for that person, is really what's going to make a difference, right? And I think of it in terms of how can I get this person the most happy birthdays that I can get them? And
Mm,
that is really good preventive screening, but it's also treating medicine, or treating food, excuse me, like it's medicine, right? So 4 times a day, you're eating your healthy foods, you're getting your exercise like it's a medicine because it really is. And, getting your sleep like it's a medicine because it heals you better than almost any medicine that we have on the market. So anyway, that to me is the missing piece. And for me personally, and in my professional career, I think that that's also true, just trying to get at the root cause of some of
mm,
these health problems.
mm.
And treating myself too, right? Like working on my own sleep and my own exercise and making that a priority instead of, doing the traditional American doctor thing and working through lunch and,
Yeah.
there's
Yeah. Will you go and tell us one more time the 6 because that was really powerful. The 6
absolutely
pillars.
right. So the 6 pillars of lifestyle medicine are nutrition. They're mostly focused on plant based eating, sleep, 6 to 7 hours, stress reduction or management, right? Stress is inevitable, just managing it. Exercise, right? So activity, exercise, just staying fit, avoidance of harmful compounds. So alcohol in excess, drugs, smoking, those kinds of things.
Super powerful. I mean, that right there. I'm like, that right there
Mhm.
is
That's it.
so good.
95% of all of our if you could just do those things. Oh, wow, I'm sorry, I forgot one. I forgot one. Social. So being socially engaged in your tribe, right? Like, so your people,
Right?
not
Not isolated.
necessarily any social interaction, but being with people who are supportive and understand you and get, kinda your people.
I love that. I love it. I mean, I resonate with all of that. And I've personally studied relationships and the brain and mental health and why we do the things we do. And but I obviously am not a doctor and I haven't studied it from a physician's perspective on how to heal our bodies,
Mhm,
and how to heal them genuinely. I love my sleep. I don't understand people who say
mhm.
I don't sleep. I'm like, I love my sleep.
Right. And so
But
much of
it's
it
so
is
important.
self-inflicted, right? You're just are into a movie and you stay up a little later and what's an hour? But it all adds up.
It all adds up. So interesting and so important. So, if people want to find you, are you okay if they ping you on LinkedIn or reach out
Yeah.
to you? Obviously, and they're your community. Come see Dr. Neal or go for a walk with her every month, which is just awesome that you guys are doing that. I really love that. I mean, I do think that at the end of the day, the core of human population wants to be healthy. We do. I
Mhm,
feel like we feel like it's unreachable because the physicians are inside the building or I can't afford, to change my habit and or I just am not disciplined enough, whatever it is. And so the
mhm.
walk gives them that. It's saying, come and walk, come and learn. Let's, build our tribe. Let's lock arms. Let's get healthy. Let's learn. I love what you're doing. Thank you for doing it. Thank you for being on here. I know I'm inspired to go live a healthier life and to continue to learn from people like yourself. So thank you again. Is there any last words you would like to leave us with?
No, April, I would like to encourage everyone out there to go on a walk, take a friend, work on eating all your veggies. That really does matter too, and get your sleep.
Yeah, I love it. I'm gonna do it. I'm actually like I was just gonna text my husband like we're going for a walk tonight.
Yay,
That's
good.
so good. Thank you for your time. Have a wonderful rest of your day, and thank you for being you and really wanting to genuinely help patients. It's refreshing. So thanks so
Of course. Thank you, April.
much. Every leader has a story, and every story reveals another piece of the bigger picture. What if the missing piece wasn't something you had to find, but something you were meant to become? Subscribe, share, and keep leading with intention. I'm April Reed, and I'll see you in the next conversation on The Missing Piece.